Exercise is one of the most important remedies which can help us to get rid of these kind of problems of frozen shoulder. First, we should be doing the rotation as a warm up when we are doing the standing activity. Hi, I'm Dr. Tehmeena, your physio fitness and rehab expert, and today we are discussing about frozen shoulder. Now, in frozen shoulder, what happens is that the shoulder capsule gets tightened, adhered to the joint, that is the glenohumeral joint at the shoulder. That's why the movements gets restricted in all the joint, in all particular angles. So, what are the different angles? Its flexion, moving forward, the overhead activity becomes difficult, moving it overhead. Then moving it sideways also becomes difficult. After a particular angle, we cannot move. It happens mostly because of if there's some kind of injury, prior injury when we are doing a gym or we are lifting something heavy, all of a sudden, then we get a jerk in the shoulder. We can injure our rotator cuff muscles. So that's how we start with frozen shoulder. We don't understand, we don't realize, and we keep it immobile for a particular period of time because it's hurting. Exercise is one of the most important remedies which can help us to get rid of these kind of problems of frozen shoulder. The first one would be lifting it up straight and moving it upward. So we'll get a range of almost say 5-10 degrees more towards the end. Now we are moving it into abduction. The shoulder has to be pulled out like this, little oscillatory movement, and till the range, like his range is 90, we'll try to go to 100. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So you can relax, head down. Yeah, I'll push it. Yeah. So little rotation. Really, the elbow should be touching the bed, but right now, since the shoulder is restricted, so the elbow is not touching. So our aim is to touch the rotatory movement. It is definitely much more painful than the flexion and the abduction of the shoulder. So we need to fix the arm, the forearm at 90 degree, and try to bend it from the elbow once downward, touching the plinth. Like this, whatever range is available. We cannot push much. We can push up to maybe 10 to 15 degree more than whatever is the range of the patient. And here we are applying a traction force at the forearm and then trying to do it. Is it done? Yeah, okay. First, we should be doing the rotation as a warm up when we are doing the standing activity. So we are trying to stabilize the scapulothoracic joint and try to move the glenohumeral joint. So that's how we are trying to do the movements in lying position, because we can reduce the compensatory movement that way. Yeah. So now we are trying to move it up along the trunk, the arm, and then down. So whatever the patient can do with little end range push by the therapist is needed. This is the most important exercise where we ask the patient to bring one foot forward and we support the shoulder with our palm and ask the patient to push against our palm and then try to take the hand into internal rotation, which goes behind the back for the rotation. So there are few exercises which you can do as a home remedy for frozen shoulder, few stretches which you can do on your own at home. So the first one would be a pendular stretch, where the arm has to move in a pendular direction. Yeah, this way, clockwise maybe 10 times, whatever is the radius of the circle. You are trying to make a circle. This way, clockwise, and then maybe anti-clockwise. Yeah, whatever range, 10 times this way, 10 times the other way. Then we can do the wall crawling. So so the patient has to go towards the wall and try to crawl. Yeah, as much as the patient can crawl, and then slowly come back. Number 3 would be, we can try to hold a towel at the back. So where suppose there's a towel and with which a towel is being held like this. So the affected arm would be below holding the towel, and then we are trying to pull the towel with the unaffected arm this way. So maybe, the way we move the towel, Yeah. So we are pulling the towel and automatically this arm would also move inward. So this is the rotatory movement, internal rotation would be taken care of while doing this towel stretch. Last exercise would be we try to move the arm, yeah, this way, nahi. We can move the arm like this and try to move it across the chest. Yeah. Can you feel a stretch here? Yeah. Yeah. So this stretch has to be felt. So we hold it at the elbow and try to go across the body. So this is a movement for the scapulothoracic joint as well. So this is very effective in improving frozen shoulder. In frozen shoulder, the muscles become very stiff, so we need to relax the muscles by using modality like we use IFT quite often for frozen shoulder along the most painful spots, like sometimes this biceps femoris muscle that also gets hypertrophied. We are doing IFT because IFT generally helps to relax the muscle. So these are the various exercises that you have seen can be done in frozen shoulder. And it's not that when you are doing it with a physiotherapist, that's enough. You'll have to do it every 2-3 hours. Whenever you are like little free or you are working and you need a break, you should do few exercises on your own. Do these exercises if you are having some kind of a problem, like as similar as we have discussed, of frozen shoulder, you will be definitely benefited with that. Thank you.